Do you know the first thing you must do to help someone with depression? Here are practical tips that you can use to help someone who is having severe depression. So welcome to Mental Health and Science with Rev. Enoch Francis. If you are still new to this channel, I request you to subscribe because it motivates me to make more videos. The first thing that you have to do when you are dealing with someone who is having severe depression is to give them full attention. Okay? So what we mean by full attention is that when you are talking to someone who is depressed, they are looking at you. They are observing you. So when you have when you are having distractions, you are receiving phone calls, you are calling people, someone who is having depression will not listen to you. Someone who is having depression will not open up and talk to you about their problems. Sometimes you mind about the body language that you are using. Like you are talking to someone, please you tell me, I'm going to help you overcome this problem. Okay? But when that person reads your body language, they see that this person cannot what? Cannot help me. So such an individual will not what? Will not open up. Okay? So we say that the first thing that you have to do is give this person full attention, avoid distractions. If it means if you're a clinical officer or if you're a person at home, make sure that these other people are not there to listen to the story of the patient. Okay? That is opening up is the first process of healing in people with mental illness, especially severe depression. Okay? The second thing that you have to do is explain your role. Okay? In most cases, you may be a young person who is helping someone who is having depression. Like for my case, I have helped people who are mature than me. They have more children than me. But the first thing that you have to do is explain your role. For example, you say, my name is Enoch. I am a psychiatric clinical officer. I am here to listen to you and see the way how to support you. Okay? I am not, I may be younger than you, but we are here to discuss ways of how you can what? We can support you. So if you explain your role, someone will be able to understand you and they'll be able to open up and give you the information that you need so that you can be able to guide them. Then the next thing is avoid empty promises. Okay? Most people, you can be a counselor, you can be at home. Some of us want to be good counselors, or we are good counselors. We give people promises that now I am going to help you, whatever problem that you are having, I'm going to help you to overcome it. So we are saying that if someone is having severe depression or is having depression, don't make empty promises. Okay? They can tell you a problem which you cannot solve. For example, I have been in a refugee settlement where someone is married to, in Rwanda they had a genocide where someone is married to the Tutsi, and also this person is from the Hutu tribe. So the other family of the Tutsi do not like the Hutu. Okay? But now they are mistreating this lady and tells me now you cannot tell that lady that now you leave the children, you leave this, because they have a connection. Okay? So the first thing you have to say, not again to make promises that I'm going to help you overcome it, but you are there to guide those people to make informed decisions. Actually, you are not the one to give them decisions, but to make for them decisions. But you are there to help them to make informed what? Decisions. Okay, so don't make empty promises that I will do for you this, I will help you to overcome any problem that you tell me. If you are new to this channel, I request you to subscribe because this motivates me to make more videos, and I appreciate you so much for watching my videos. Then another thing is to acknowledge their pain, the way they are feeling, and in most cases patients they are going through a lot of pain. So you as a therapist, you as a caretaker or someone at home is to acknowledge the pain that they are going through. Okay? So if someone tells you that now I have gone through this, I'm separated with my husband, and I feel lonely, you acknowledge, okay, I understand, okay, the way you feel, okay, and even you yourself, if someone will say, now you're a younger man, how are you going to even to help me? Even if I tell you my problem, you are not going to what? To support me, okay? So it is true even you as a therapist to acknowledge your problem. Say, yes, I am a younger man. Okay, I cannot help you to overcome. I am younger. I may not have all the solutions that you need, but I am here so that I can guide you to make an informed what? Decision. Okay? A person who is understanding, a patient who is understanding, hears those words, is going to listen to you and is going to open up and give you the information that you need. So you acknowledge that you cannot help them out of each and everything, but you are there to guide them, and also acknowledge that you are there to support them to overcome their what? The challenges that they are going through. Then also, the second last thing is collaboration. Okay, when you are helping someone who has depression, is collaboration. You are there to give them, to guide them to make their decisions. Okay, if they are living with a husband, maybe they have separated, or they are going through a difficult time. For example, someone says, I feel this man has left me, I cannot live alone, and what? And I feel like dying. So from what they are telling you is what you are able to guide them. So you have to be an active listener. Okay? If someone is still leaving the husband and they feel like separating, you ask them, okay, is that the decision that you want to make? Okay? What about these children that you have with him? Don't you think they need you two people together, a father and mother together? Okay? From there, you are helping someone to make an informed decision. Say, I want to kill myself. Say, okay, but who will take care of these children? So you have to help them understand the implications of their decision. Okay, the outcomes of the decision that they are thinking about. That is the use of you as a caretaker, as a counselor, or as a clinician. Okay. Then lastly is listening. When you are dealing with someone who is having depression, please listen. Some of us want to start counseling someone without hearing them out. If you are not a good listener, you are not going to counsel somebody. So the first thing is develop listening skills and help someone to understand the way they feel. Then you help them to guide them to make informed what? Decisions. So as you do this, you have to pay attention, avoid the distractions we have been talking about. Then as we finalize is that you have to follow up with the person. Like if you come up with a plan, if someone says, I want to leave my husband for some time and go to my parents, then you have to say, okay, is that okay? Yes. Then you have to follow up. Is the plan working, and which things are they struggling with? Are they basic needs? Help them to find solutions to their basic needs. Okay? So thank you so much for watching my video. If you are still new to this channel, please I request you to subscribe, and if you found this information helpful, please let me know in the comment section how you have been dealing with people with depression, how you can help someone with what? Depression. So thank you so much. See you in my next video.